Good morning, America. How are you today? I hope you're having a blessed day. This is Dr. Rick again, the Maverick Doctor. I'm going to talk to you a little bit today about Exicare, this company that I conceived of in 1978 and got started finally in 1996. You may ask, why did you think of something so long before and then not get doing it until almost 20 years later? Well, the reason for that is that computer technology, when I conceived of Exicare, was not at a place and time where you could do what I needed it to do. And that is put out patient education. So anyway, Exicare, I knew that instructions for patients had to be warm and fuzzy. They had to be something they could read. Didn't need a bunch of technical terminologies. Doesn't have to be like the things you see on that you bring up on Google, like WebMD and all the other areas of medical expertise, where it's got one link going to another link, going to another link, till pretty soon you're a dozen links out and forgot what you were originally looking for. And people get lost in those searches. But Exicare, I did make it to be warm and fuzzy. I did make it to be a template so people would know what they got when they were leaving the hospital. What did they have? Initially, Exicare was started off for the emergency department, and what happened was that we found out many departments in the hospital were running down to the emergency room and asking them if they could have an instruction for this, that, or the other thing. And then finally, hospitals started asking us, can you produce this for a whole hospital? And of course I could. You probably wonder what my expertise is and how I'm able to write instructions about just about everything in medicine. For one thing, I've delivered nearly 1,000 babies. I've done several hundred major surgeries, and I've run numerous emergency departments, and I'm good at all of them. That's not by my doing, that's by God's doing. He planned this trip for me. I didn't have anything to do with it. I was very, very blessed in medicine. In my early years, my early life, the hospital where I interned at called me the gifted one. And I didn't realize at the time just how gifted I was. But I am and have been extremely gifted in medicine. And I'll tell you a little bit more about that later. But anyway, Exicare, when we started getting into a lot of hospitals and we realized we could get it into these large strategic partners, it started to grow rapidly. And we got to a point where we could hardly keep up at one time getting it into hospitals. All of our instructions were the same. They all went by a template. And that template was, when people go to the emergency department, you really want to know what's wrong with you or your little one. And because of the number of critical children I've seen over the years, or even dead children handed to me because the parents simply didn't know what to do with them when they got home, they didn't have adequate instructions, I made that proof so that would not happen anymore. So our instructions would tell you, for example, you brought your little one in and they had pneumonia. It would tell you, what is pneumonia? How do we diagnose it? How do we treat it? What do you do for your young one when you get home? What are the things that should make you start to worry? What are the things that should bring you immediately back to the hospital? All of these were written in a way so that people would understand what they had to do for their loved ones and could take care of them adequately. They didn't have to be wondering. They didn't have to be guessing and then making the wrong guess and then ending up with an unfortunate result. And that happens all too often to all families in the United States. And so exit care became the gold standard of patient education in the United States. We were really, really good, and we were growing so rapidly. We were doubling every year at one point in time. And then I'm going to go on about this story a little later, but you're wondering what's happening to Lori in the meantime with AIDS and everything. Her AIDS is getting gradually better. She's getting stronger. Her CD4 count, which had been 17, is now up to 800. So it ranged around 6, 7, 800 until one day one of her doctors said, "Lori, you're going to die one of these days, but you're not going to die of AIDS. I mean, you're going to die of old age. You're going to die of something else." Little did they see that they were not seeing her future. So anyway, I'm going to talk to you a little bit more about exit care, a little bit more about Lori on down the road. God bless all of you. Have a very blessed day.